Hi, this is Josh with Dream Body Clinic. Welcome to episode 3 of DBC Diaries. You're going to see Mark, a returning patient in this video. We fixed his hip early in 2023, and he's now back to fix up his shoulder because he had such amazing results with his hip treatment. So we're going to take you on this journey showing how it is to come here to Dream Body Clinic in Puerto Vallarta, do treatment, get fixed up, and hang out in paradise. So take a look, we'll go from there. Okay, today all of our drivers are on break. It's their day off, getting a little rest. But Mark needs to go to his MRIs, and that makes me the driver. So I'm his driver today. Let's get at it.
Hola, soy Kevin, soy el jefe de choferes de Dream Body Clinic y en este momento debo ir por Mark para traerlo a la clínica.
Today Mark's coming in to do blood work. We are going to take a blood sample with our nurses, then we're going to send that sample off to the lab for analysis. Before treatment tomorrow, we will go over these results. The doctor will explain everything line by line, so you know exactly where your health is at. This gives you something to compare to in the future and also allows us to look for any markers that might be sticking out that could be an issue. Once we've gone over that, we are able to go upstairs with our admin team, and this is where we take care of payment for treatment and then get you back to your hotel to rest. This is treatment day for Mark. For a lot of patients, this would actually be the day they would come in and review their blood work and their MRI with the doctors to decide on treatment. In Mark's case, we already kind of know what the issues are, so we're concerned. We're going to do treatment today and review that now. For a lot of people, this would be the day you'd come in and review those MRIs with the doctor to go over everything.
Hi Mark, how are you?
I'm well.
I'm Dr. Liz, nice to meet you. Hola, buenas tardes, yo soy la doctora Lisbeth Aguirre y para conocer un poquito acerca de la condición de Mark, veamos sus resonancias magnéticas. Well, this is the MRI of the patient Mark Valent. Here in this area we can see the muscle supraspinatus, and here we have the tendon of the supraspinatus. He has a little tear, it's a partial tear of the supraspinatus. Here in this area, we have the acromion clavicular joint. So he has arthritis type 2, and he has a tendinosis of the subscapular tendon. Para poder tratar la condición de Mark, es necesario infiltrar 50 millones de células y pronto veremos los resultados positivos.
El paciente Mark se someterá a tratamiento de hombro, el cual es uno de los más solicitados aquí en DBC. El tratamiento consiste en una inyección rápida y es no dolorosa, es indolora, para el cual requerimos tomar una muestra de sangre para obtener su plasma rico en plaquetas antes de su consulta médica, el cual el médico lo usará en su tratamiento, mezclado con las células madres.
Now I'm going to clean the area with iodine. We're going to show you. We have 2 vials with 25 million of stem cell each one, and 1 vial with your PRP. So I'm going to mix everything.
Okay.
And I'm going to use the ultrasound another time. And first I'm going to touch. And I'm going to do the injection. You can feel a little pressure, it's normal. And we finish.
Hey Mark! All right, this is Josh, Dream Body Clinic, and I'm here with Mark, returning patient. Mark was kind enough to be part of our DBC's Diaries series, and you were here last, when was it, like February, I think, right?
Yes.
And last time we got your hip fixed up. That was kind of the main issue, right?
It was the second time that I'd come in. I'd been in actually 3 years prior, and then came back and got it again.
Great. Well, how have things been going for your hip?
So when I was coming in for the first one, I had already scheduled surgery to have a hip replacement. It was quite painful. It kept me up most nights, and the procedure was such that I canceled the surgery.
Ah, that's awesome. Cool. So you did that, and then I guess we got it partially repaired, and then you had to come back to kind of finish it off, right?
Well, I figured if once was good, twice would be better.
Always.
And it did make some more improvement. And it's not like I have a 19-year-old hip at this point, but I can sleep through the night, and I can walk 18 holes of golf. So those
Nice.
are important things, and that I would call that successful.
I think so. That's awesome. I mean, to be able to get out there and do what you love, I mean, that's what we all want to do, right?
Yep.
So you're able to get, like, you like to come down here, get on your boat, have some fun, right?
I do.
That's awesome. Well, cool. We're glad you're back, and this time we're getting your shoulder fixed up. Like, what'd you do to your shoulder?
So I actually hurt my shoulder 50 years ago playing college football.
Okay.
And I've just kind of dealt with it. Dr. Liz showed me the MRI, and apparently I have a slightly or partially torn tendon.
Okay.
I would be hard pressed to tell you what the name of it is, but anyhow, she seemed to think that this would be helpful, and so the injection was administered this morning, and 3 to 6 months we'll see where it is.
Perfect. How was the injection? Did it hurt?
No, it did not. It was relatively painless.
That's awesome. Yeah, shoulder treatment's great. The good part about the shoulder versus the hip is the hip, I mean, you're going to always keep pressure on it walking around. It supports your body weight. With the shoulder, it's a lot easier to stay off of it. So we always recommend for the next 2 weeks, just take it real easy. No major workouts, anything like that. And at the end of those 2 weeks, we provided you in your folder with a rehab protocol we developed with an orthopedic surgeon we work with. So there'll be 4 weeks of like light rehab. Feel your body out. Some people are able to get back sooner in that, but in my experience, because I've done it the wrong way and the right way, I found it's always best to do that rehab therapy, because I hurt my elbow last year and it was like a 50% tear of the tendon there, and I didn't let it heal, and that's what really made it so much worse. So it took longer to heal. If you do that, usually at the end of that 6 weeks, you're able to get back out there, start playing golf again, doing the things that you love to do, and then peak results, like I'm sure you saw with your hip, usually between 3 to 6 months, and good to go.
All right, well, anxious for it to happen.
All right, well, we'll go from there, and thanks for coming back and being part of this. So with this is the day you're going to go home. So it was a pleasure to welcome Mark back to go through all this. We really appreciate him letting us film so we could show other people what we're doing to help, how incredible stem cells are for repairing joints. You know, he's already fixed his hip, now he fixed his shoulder. Thank you for watching another episode of DBC Diaries. That was Mark's story. We fixed his hip this last year and now we fixed his shoulder. If you're a returning patient and would like to share your story, please get a hold of us. We'd be happy to share your story just like this with others. And if you're a patient or potential patient interested in treatment, know you can call us anytime toll-free at 833-445-9089. You can get a hold of us, we'll answer any of your questions, and you can check out the website at www.dreambody.clinic. Scroll down on the homepage, you'll see all of the treatments listed, all of the prices, information. We go out of our way to be as transparent as possible, to have as much information that's good and accurate there for you, and that's where we're at. So I'm Josh, happy to help.